The innominate grooves, often invisible clefts in the mucosal surface, run transversely around the colon. Circular muscle fibres can indent the transparent mucosal surface, which shows its fine vessels or vascular pattern. Often the vessels are seen to be paired, arterioles and venules running together. Venous lakes, dark blue raised blebs, are a normal variant of no significance. Major vessels are visible too. In the sigmoid, the single pulse of the left iliac artery. In the transverse, the impulse of the aorta can sometimes also be seen. Or the double impulse of the heart against the diaphragm. The longitudinal bulge of the Taenia coli runs along the transverse colon. And the Hausdorff folds run transversely. The grey-blue of the liver is seen through the colon. And the colon moving around against the hepatic surface. Bile salts, detergent-like, can cause bubbles. Silicone solution lowers the surface tension and gives a better view. Arriving at the ileocecal valve and its slit opening, the scope is steered in and, with a little patience, passes into the nodular, villous surface of the ileum, sometimes with visible vessels and opaque Peyer's patches of lymphoid tissue. Alternatively, seeing the appendix direction, angulating and pulling back, it may fall into the rough surface of the ileum. Ileal villi can be relatively short, even when seen underwater. Or the villi can be longer. And there may be lymphoid nodules in younger patients. The appendix region, too, often has prominent lymphoid follicles. And lymphoid follicles may be visible around the colon. Dye spray makes them more obvious and shows up the opening on top of each one. The opening of the appendix can be a raised whorl like this. This inverted appendix stump shows its lumen. This one doesn't, but don't snare it. This is a mucocele of the appendix. Of no importance, just a rare curiosity to be left alone. Appendicitis can be obvious like this, but the abscess can be at the appendix tip, so the opening may look normal. Now, to skip back to the other end, even with a normal anorectum, the rectal veins can be very prominent, even tortuous. Hemorrhoids can be obvious in retroversion, and also partially visible on withdrawal. But much more obvious with a proctoscope in and the patient straining down.